Hello and welcome to the Leaders Council podcast with me, Scott Challoner. This podcast, just like the Leaders Council itself, is all about recognising and celebrating those people who keep this great country running. We exist to give leaders a voice outside of their own organisations and to support them in the same way that they support their staff every single day of the week. Now, if you are in a leadership position yourself and would like to have your voice heard on the national stage, then please do visit leaderscouncil.co.uk/apply. Now, each week on this show, I'm joined by a different leadership figure from the world of business, education, politics, sport, or perhaps even from local communities, in the aim of truly discovering who those people are that get up every morning and make this country work. We get their take on the current economic and political landscape of the UK and discuss everything from leadership and wellbeing transformation to caring for our nation, and of course the success and the innovation that makes it all worthwhile in the end. I'm delighted to say that my guests on today's programme are firstly Jeanette Phillips, CEO at Flexicare UK Ltd, a care provider who ensure individuals receive due care in their workplaces, at home or on holiday, and also Kevin Thomson, founder of WoW 5 Ways and 5 New Ways to Wellbeing, and Sally Thomson, his partner and in the WoW business and also a qualified barrister. The WoW business puts health and wellbeing into organisations and individual clients through various innovative platforms and programmes. Without further ado then, ladies and gentlemen, let's welcome our three guests, Jeanette, Kevin and Sally, onto the programme. First and foremost, Jeanette, Kevin, Sally, good morning and thank you all for joining us on the programme today.
Good morning. Good morning, and thank you for having us, Scott.
Yes. I think a good place to start, of course, would be by addressing some of the context of this situation that we find ourselves in as we record this podcast on July the 21st, 2021. We're still very much in the thick of the COVID-19 situation, even though restrictions have now been lifted almost completely in England. And Jeanette, you've been very much on the front line throughout this, haven't you?
Yes. I'd like to start, if possible, Scott, with a 1-minute silence to respect and pay tribute to our colleagues in health and social care who have lost their lives. I'd like to pay tribute personally to their courage, their compassion and their commitment to duty. And I think a minute's silence is a great place for us to start. Thank you, Scott.
Yeah, I think that's absolutely right. And we can start that silence from now. Impeccably observed by everyone, and on behalf of the Leaders Council, I'd also like to thank all NHS and frontline care workers who've sacrificed so much over the course of the last year. Now, I think a good place to start the discussion would be by talking about the partnership that has developed between Flexicare UK, the WoW business, and also Yonder Desk, which is helping develop some of WoW's virtual wellbeing platforms. So please, all of you, feel free to expand more upon each of your businesses and their work, and do tell us how and why this partnership came to be.
Well, if I can start here, this is some 7 or maybe more years where I had the wonderful pleasure at the NEC at a care show where we had a WoW business stand, and Jeanette came up and we struck up instant friendship. I think is the best way of calling it. We've been following our separate paths for the last 7 years, while Jeanette's been developing her social care and hubs and hublets idea, and while we've been developing the whole concept around the 5 ways to wellbeing. I think that was where it started, wasn't it, Jeanette?
Absolutely. You've encapsulated everything, Kevin. We've been on separate paths, but very collaborative in our aspirations. And I feel that by building the hub and hublet model in Gloucestershire, we've almost come to the end of the road, but the beginning of a new road. And that is what the point I wanted to make really clear, that some things come to an end and great things happen. And pure serendipity or coincidence or whatever you believe in, Kevin made contact and we're ready for the future. Kevin, do you want to add to that?
No, I think probably would be a really good idea as well, as we're talking about colleagues at work, is Sally's a barrister and she's seen the impact of this right throughout the court system.
Yes, but obviously the pandemic really caused the already slowly grinding wheels of justice to grind even slower. Again, a lot of staff very committed and kept things going throughout. But now, of course, we have a massive backlog of cases to get through, which has an impact on everyone in the justice system. But I think one of the positive things that's come out of this is that we have discovered new ways of working. And really, I think all three of us are agreed that we need to look forward to face the challenges and to carry forward some of the new ways that we found to work to manage the situation, because we can't carry on as we were. We need to change, and so we need to take the positives out of the changes to our working lives, as well as, I think, build the resilience in relation to protecting ourselves against all the negatives.
Indeed, and at the Centre of Practical Innovation in Care, there's a radical virtual rethink in leadership care and wellbeing strategy that you've devised, isn't there, as well?
I think this is where Jeanette talks about the end of the road, but actually the road that Jeanette's been building is the real world of her idea of hubs and hublets. It just absolutely love it to pieces. And when we set up the WoW business, we were going down the same track in terms of financial well-being, of having centres of like the one we've got in Datchet is essentially a hub. And then around that hub, you build the financial experts who are working often from home in their own rooms, and so to be able to put the concept, the real concept of hubs and hublets into the virtual world, and the piece for us that was missing around well-being was whether you want to call it the Facebook or the WhatsApp or the Hangouts or the Zoom of well-being, allows us to do this with the awesome power that we've got with Yonder Desk. We're putting it all together and we're calling it FlexiDesk Online.
And mental health and well-being are issues that are being significantly amplified by the COVID-19 pandemic, aren't they? Of course, back in 2008, we saw the publication of 5 Ways to Wellbeing, which included connect, being active, taking notice and being curious, keeping ourselves learning and then giving to others. And that was, of course, published after the New Economics Foundation reviewed over 400 scientific papers to identify key things that could contribute to our well-being. But NHS take-up of that was quite passive. It failed to build any real momentum and cultural change around wellbeing. And that was largely through a lack of real well-tech apps available at the time and coordinated platforms and sustained programs. So this suggests that there does need to be a new beginning, as you say, where virtual and real social care are coming together in that hybrid format.
Yes, I think there are 2 issues here. I think one is we know from the 5 Ways to Wellbeing that the most significant one is to connect. And if we have good quality connections with other people, that really enhances our well-being. So there are 2 things really that enable us to connect. One is the means of connecting, and the other is the quality of that connection. So I think the skill is to bring those 2 things together, so we can use new means. And we've all got very adept at or not, using Zoom and other methods of connecting. But we mustn't forget the quality. It's the quality that underpins everything. And that's what we're seeking to achieve with Jeanette, that it's not a substitute. It's a way of enhancing the connectiveness that's already there and adding to it. But we must never forget about quality as well as the means of connecting.
I think Jeanette talks about it, and I love her talking about it. She says we haven't just got a pandemic, we've got an endemic, and the endemic is learned helplessness. And so what we've been working on the WoW business is the 5 ways of providing the ability to create that quality and quantity of connection through planners and through training programs and all the rest of it. But I think if you listen to Jeanette talking about learned helplessness and the endemic that we're in, that's one of the key issues that I think we're trying to solve, Scott.
No, I was going to say that the last 4 or 5 years we've been concentrating on our workforce qualifying with a care certificate underpinned by the 6 C's of nursing. And our team, Sally and Kevin and myself, hypothetically think there should be a seventh C, on which is connecting, because that way you get the preventative, the more proactive, the more well-being, which then reduces the need for care. If we can get a generation to be fitter, healthier and stronger of mind, body and spirit, and then that long-term reduces the cost for social care. So, I read this morning that the prospect of having the national insurance increased is something that they're considering. I think it's almost like we could have a personal responsibility to health and well-being combined with some kind of insurance, maybe a way forward. So that way, the hybrid hub and hublets could actually help. It's changing people's mindsets. So would you agree, Kevin and Sally?
Oh, yeah, absolutely. Jeanette, mindset comes first. And I've been doing a lot of studying around mindfulness, and it's as within, so without. So it seemed to me that I couldn't be preaching about well-being if I wasn't trying to address my own well-being issues. And just every day sort of focusing on the 5 ways. What have I done today to sort of tick any of those boxes? And what plans do I have to sort of make myself the best I can be? And I think that's right. It's having that mindset, because if we all look after ourselves as best we can, then we're going to be less of a burden on the NHS. And whilst all of us, and it's marvellous that the public feel so passionately about the NHS and would be happy to pay some form of ring-fence tax for the NHS if there were one, and I appreciate that might be difficult in practice. But it's not just about giving our money. We have to change our mindset. We have to keep ourselves as well as possible, so that in the future we're not a burden. And of course, all sorts of catastrophic events can occur that we don't have control of. But there are lots of things such as the obesity. I'm going to call that an epidemic because it's a massive issue, and we know sadly so many people lost their lives to COVID because of being overweight. So we need to take up personal responsibility where we can.
We do, don't we?
Oh, absolutely, Sally. I think it's the hybrid, the FlexiDesk and the hybrid hub and hublet would almost become a way of life to encourage future generations that their health and well-being is their responsibility, and it will become the norm. I'm absolutely certain on that.
I found it quite striking myself, actually, that when reading the CQC's own strategy document, the word well-being only comes up one time, and I suppose that really hits home, doesn't it, that sometimes the need for proactive well-being and that personal responsibility isn't necessarily being noticed.
It's funny you mention that. In fact, I've got it in front of me here, Scott. The Care Quality Commission, it says on the front cover, the world of health and social care is changing, so are we. we want to hear what you think of our new strategy. Well, it was on Jeanette's desk, so I started, and she has got it underlined, and she's got all her pink markers all over everywhere. So I'm looking at this, and I see care. Our up-to-date view of the quality of care in a service will help people and their families make informed decisions when they're choosing where to go for their care. This means they can be confident in the knowledge that reflects the quality of care. And we know care is better, and the need from care services, your local health. And I'm thinking, and so I'll send you a picture, Scott. I started ringing the word care, and then I found more and more and more and more. Oh, this is interesting. And so I'll go through it and see if I can find well-being. I added it all up, and care is mentioned 100 times, and well-being is mentioned once. And yet, the Care Act puts well-being first and said it's the duty of local authorities to ensure well-being, and care sits under well-being. So if you get it right in the beginning with well-being, then care sits under that. And yet, so they wanted to hear what they think of our new strategy. Well, what I think is it needs to be 100 words of well-being and 100 words of care. That's where I'd got to.
Absolutely, here. It's the wrong way round, and I think that is synonymous with the type 1 thinking. The research that we've done in the CPIC is very much type 2 thinking, which is thinking about things in a completely different way. But the reports have turned out with the same thinking. But if you have the same thinking, you get the same doing. So this is what we're trying to almost break the cycle and go forward with positive culture, mindset, and action.
And with all the talk as well about building back better from the pandemic as we recover economically, I think ultimately this virtual approach to social care has the potential to also be that green solution that we crave, doesn't it?
Oh, absolutely. I think from social care, you could have 3 words: cleaner, leaner, and greener. And you don't need to say any more than that because the solution is here. And building on positives, I think that's the thing after the Zoom with Lord Blunkett in April when the country was a little bit at a standstill. The building on positives theme emerged, which if we build on positives and we look at what we can do, opposed to what we can't. And this last year here at Flexicare UK and the CPIC, we've continued that theme of building on positives, working with Professor Tony Gay on the You Matter campaign to make sure that people really understand that they matter, and just every single day focusing on positives. And it brings about wonderful things. It's amazing. It's just about every day focusing on positives. We have positive portfolios for all the new PAs on board, and everybody now talks a different language. One of the words which I was particularly unkeen on in social care was shadowing, primarily because we wrote a paper, Ian Briggs, 6 years ago, Leap into the Light, and shadowing, words are very powerful in social care, and I think sometimes they have connotations. And so I think when Matt Hancock was Health Secretary, he said he wanted to bring social care out of the shadows, and I think that's a really, just changing simple words can make such a powerful impact and difference. If you change the language, you change the action. So, sorry, but that was my bit. So.
No, completely agree. Kevin, did you have anything to add to that?
Yeah, I think I'm going way back now in my times of when I thought I was a communication professional and had a business and wrote a fun book which came out, an F.T. Pittman book called The Company Culture Cookbook. But ironically, my whole message wasn't about culture. Organizations spend all their time trying to change culture, and I define culture as what you think, what you feel, and what you believe. And what the real issue is the climate. And here we are 20 years later on, and we understand climate change now. And climate change is what you say and what you do and what you look like. A culture of climate, looking after the planet, you can come up with all the words, but the actual climate is what you actually do about it. So I think the focus sits around, as Jeanette says, is the language. what you actually say, what you do, and how you do it. But the critical part to that is habit forming, and that's where the 5 Ways to Wellbeing fell down. A fabulous research, a great concept to come up with, 5 things like the 5 things we eat every day. And then their own NEF analysis in 2012 said, well, essentially it's like a poster campaign, and it's reactive. And so putting in habits to allow people to change, like we've got on our leaders compass that we've done, the care compass. Right at the top is the 5 Ways to Wellbeing, and here's your daily planner. And what your daily planner lets you do, you'll get a reminder every day, and the reminders around the 5 ways. We've taken the model of the yoga type thing, and the Calm apps and all the rest of it, and applied that really simple model to allowing you to do things differently. And I think it's the habit forming of changing our climate. And this is where Sally comes in, and Jeanette will come in terms of what we'll actually be able to do. So,
yes, I mean, what we would foresee is that every organisation has its wellbeing champions, and that their role is to lead by example to start with, and to help and encourage everyone in the organisation to build on their own well-being through practicing the 5 ways. So that's our vision. So far as enhancing the nation's well-being is concerned, and we all have a responsibility to everyone in our lives, whether it's at work, whether it's at home, whether it's our family, whatever our connections with other people are. We all have a responsibility. And we need to have regard to other people's well-being. And I think at the moment we do have a reactive firefighting culture, whereas good employers will have systems where if employees are suffering from stress, they can refer them to the relevant professionals and make sure they get sufficient time off work and their return to work is managed. But if we focus on trying to avoid people getting into that situation in the first place, that's a much better outcome for everyone, not least the person suffering from stress, and the impact that has on their economic situation, their dependents, and so on. So we do want to really focus on the positive, on taking personal responsibility, and on building personal resilience.
And I think the virtual hubs and hublets has so much potential there. I've looked over the idea. I think it's absolutely fantastic. And with self-isolation and personal isolation in the community being exacerbated by COVID, there really is that need now for that stronger social connection. And virtually, this is where those hubs and hublets come in, doesn't it? It makes those connections possible.
I do think we need to sort of capitalise on the COVID and pandemic spirit that at the beginning of the pandemic, how everybody pulled together. We can continue that. It's shown it can be done. And then, so I think the change in social care is not just about money. I think it's about a different way of thinking, as Sally said and Kevin said, a different way of thinking, a different way of doing, capitalising on the spirit shown mid the first wave of the pandemic, and just making that the new norm. And we have the solution to do it. Scott. So that's, I want to sort of sanction what you're saying, Sally. I do think it's all about positive. I think there's some other negative language been used in social care. Compliance, very fear-based. You must comply. We've changed that to streamlining. We have streamlining. We have positive portfolios where all the PAs are encouraged to be the best they can be every day. So it's all about focusing on actually what works, focus on the positive. We had some health and wellbeing research done as long ago as 2014 by Dr. Ravalier in Bath University, and the focus was actually on employee autonomy. How much autonomy do our PAs have in their role? And we came out extremely high. It was early days of health and wellbeing research, but people having autonomy. And that's what we facilitate here. We make sure that they have the hours that they want with their families, because health and well-being crosses across all the strata of your personal life, as Kevin and Sally said. So that's my thoughts anyway.
I think one of the things that Jeanette's able to demonstrate, which is a core to our approach to the 5 ways of well-being, is social care isn't about just the people you care for. We talk about customer care, we talk about colleague care, client care, community care, and every organisation has got what we call the 5 stars of outstanding care. And the first one you start with is your colleagues. The issues that most employers have got is that we call it the iceberg strategy. They understand care at work, but the YouGov benchmark that we developed, underneath the surface of the iceberg, you've got personal well-being, and there are a whole bunch of issues around personal well-being and financial well-being. My colleague in the WoW business, Chris Masters, he's an IFA, and he came to me and he said, "How do we make financial well-being exciting and people want to do it because they're scared of it?" But those personal and financial issues come to work, and as Sally said, the answer is don't talk to us about it. Here's a telephone helpline if you get into stress, or there's so EAPs, employee assistance programs, are great at, again, the reactive. The beauty of the proactive one, it says our responsibility, our social care as an employer, not just in the care industry, which is what Jeanette's demonstrating with Flexicare. Our responsibility as employers is the social care of our employees, but to give them the skills, the tools, the ability, the confidence to run their own personal responsibility around both personal well-being and financial well-being.
It's very fascinating, that iceberg effect, isn't it? That's essentially to say that there's 10% that employers see when it comes to well-being on all 3 of those facets, and 90% that they don't. So there are so many hidden issues relating to personal and financial well-being that are brought into the workplace, as you say, Kevin, and it's about getting our business leaders to be able to notice this, isn't it?
Yeah, I have a thing about it. I'm told never to knock the competition. I'm not knocking the competition, but the Gallup survey says I have a best friend at work. I mean, that's a great one above the line, that you do have contacts at work, but that sits within the 5 ways of well-being. How well are you connecting with people? Not just a best friend at work, but I've got lots of friends at work. They're not just colleagues. There are people who, if something goes wrong, like with customer care, a customer comes in and gives you I spent my life doing customer care. If the customer comes in and gives you a bad time, it's your well-being that's impacted. So whilst we talk about customer care, we also need to be talking about colleague care. It takes 4 positives to overcome 1 negative, and that's just the stuff at work. Customer care or client care. The real issue, as you say, Scott, is the 90% that sits underneath the waterline. And we're not asking the employers to solve that problem. We're saying give the skills and tools and techniques. But the great thing we've got now is we now have the tools and techniques that around well-being. And we also have the tools and techniques using Yonder Desk for people to be able to connect, actually see each other and talk to each other in the virtual world. And this hybrid working is causing huge levels of stress. You're at home, you've got the kids around you, you're looking after granny, and all of those issues are bound to impact on you. And to be able to, like Sally does, to give you mindfulness training, we think is a huge part of the solution.
Yes, that's right. I mean, we did some research of our own, and we did some benchmark research back in 2015 on how people rated their personal well-being. We looked at personal and financial well-being back in 2015, and the levels were quite discouraging then. On a personal level, it was a score of minus 48%. Financial, perhaps unsurprisingly, worse, because people do struggle organising their financial affairs. That was minus 63%. But we were shocked to find when we came back to it in 2020 that on personal well-being, the score had dropped to minus 76%, and financial dropped to minus 77%. So people are obviously struggling to manage their personal lives. There's so many stresses and demands on us, particularly if you have other caring responsibilities. So we need to use technology to find a way to steer people through and to help them to be more resilient. So that's what we've been doing in the WoW business, developing an app that makes it easier. Like I suppose you can think of it as being like a Fitbit, but for well-being. So it just encourages you to get your steps in every day to just improve your own well-being.
Just to add to that, Scott, what we did was we went to YouGov and said we need some data around this, our whole idea of the iceberg. And where we're looking to in the future is to run the 5 ways of well-being surveys. One run every 2 months. So we do connect, and then we do be active, then we do take notice, keep learning and give. And then in a year's time, we can come back to that. And then you can both have an organization can do its own tracking and trending and find out where the real issues are. Then underneath that, we don't just do the qualitative, we do the quantitative ones. So we have the word clouds of fear and stress and anxiety and loneliness. And so you can tackle the areas where you're working well, and you can tackle the areas where you're not working so well. So we have 3 core levels that sit under people are under massive stress. They're susceptible. They think they're okay, but they can either dip either way, or they're in the smile zone. And giving simple tools that people, organizations and individuals can track and trend allows us then to measure what we're doing and how well we're doing it on this brilliant research that the New Economics Foundation did, but didn't put anything behind it that lets it become part and parcel of your daily life.
The curiosity, one of the things that has drastically improved with the introduction of the care certificate. It's been fabulous here at Flexicare because it's encouraged health and social care to come together to look and care and support people for their well-being in a collaborative way. And I think it's all about education and getting that out there and bringing new generations into a different landscape. And that's why I'm really keen to push this, get going now, because younger people are coming through. My own granddaughter wants to go into medicine. She'll be 16 in December. She's working really, really hard. And I said, you'll be in a completely different landscape. And it'll all be about prevention, hopefully. And then biopsychosocial care, looking at the body as a whole, mind, body and spirit, and health and well-being being the driving force. That's my vision for the future. Hope it comes true. Thank you. Thank you.
And I think the fact that the virtual, regional and local virtual meeting place idea that's driven by these values of well-being, that makes this so different from such a simple connection platform like Zoom, doesn't it? It really makes this something different that's really geared towards solving the problem.
I think it was the biggest aha of my life. I thought I'd spent my life in the communication business, and when I came across the 5 ways, I realized that to connect is the number one way of well-being. And so my goal now in the communication industry is to say, hang on a sec, guys. You think you're communication managers, directors, communication professionals. You're actually well-being professionals. Because if you can get people to connect, and you can get people to listening skills aren't just about listening to finding out. Listening skills add to the whole sense of well-being. Because if you're connecting, the Harvard Business Study, the longest longitudinal study of happiness in the world, adds to the whole concept of well-being, of connecting being the number one. And they say it's not fame and it's not money. It's simply relationships that are the absolute predictor of happiness and longevity. And so once the communication profession understands that they're in the well-being business and understands that creating connections of employers listening proactively actually assists well-being. And I think the biggest single predictor of people connecting is a smile. I once saw a research that put people in a room, married couples in a room, and they could actually predict how long that relationship would last by the number of times that they smiled during that hour of conversation with each other.
That's amazing. I'd like to add just to the values and underpin the CPIC. Obviously, we have our culture at Flexicare UK is our rules, which we call them are respect, understand, laugh, enjoy, and smile. So those are our rules, and iceberg rules. And for the CPIC, our vision, Ian Briggs and myself, was to do things from the heart. So appreciative inquiry theory, and Professor Tony Gay is the absolute top expert on appreciative inquiry theory, and that is the theory that underpins done. So by doing things from the heart, the money follows. And this is why I'm passionate for people to understand that fixing social care isn't about money, and it's about doing things a different way. And the CPIC, by doing things from the heart, is drawn in by the law of attraction. Great people like Sally and Kevin, and we're all working together now, and we can create this new world. I'm very sure about that.
Yeah, and also, Scott, just like to say something about the awesome tool that Yonder Desk have created, because it does recreate your work environment, so that even if you're not working from the office, you still feel connected to the other people who are at work there. And it's really easy just to drop in and have a conversation with them. Everything's seamless. All of the communication platforms are built in. And our concept for Jeanette Phillips Hublets is that we can build an online environment that people will recognise. We can replicate what buildings look like, what the inside of offices look like. We can, you can enter through the village green or your local street, wherever you live, and you can recognise it and feel a sense of belonging, rather than just having to dial up, through a link, whatever platform you're using to connect. So, we see it really does enhance the quality of connection, and make you feel that you are still part of the team, or you are able to connect in an environment that you feel comfortable in.
Absolutely wonderful, the Yonder Desk. It's a future that you wouldn't dare dream about a few years ago, but the speed of change and the terrible virus which has acted as a catalyst for this change, I think it's all about where we are now. In this moment in time, we are in a great place to move forward, and we should do so, definitely.
It's been a period of real self-reflection, hasn't it? And if you add the pandemic into that sort of melting pot of the personal and financial issues of self-care and the care of loved ones and within the community that we've also talked about, it really proves that there's this need for a new strategic direction for our leaders within the sector. And the work-home-play framework is a wide solution for that as well, isn't it, if we touch on that?
Yeah, I think what we've done, knowing that we were going to be talking to you about this, is put together something actually for the Leaders Council. I call it the Leaders Care Compass. And moving forward, you need a direction. So in marketing, being a marketing guy, you got the 4 Ps. So we've got with product, price, place, and promotion. I've lived by those. But I think we're in a new environment now. So our care compass points to the north at the 5 ways and how you can plan those. It then points to the east and talks about the portal where your 5 stars of outstanding care come in. Your colleagues, customers, clients, community, and those that you care for. And then to the south, that allows us to then allow the communication professionals in HR, employee assistance, and all the rest of it to be able to target the messages to allow people to connect. And then working with Sally and Jeanette and the team, we're developing a bunch of programs around that. But what we had missing was the face to face, and so in the middle of our care compass sits Yonder Desk, and specifically for taking the whole partnership forward. Working with Jeanette, we're adding all of that together and calling that FlexiDesk Online. And that FlexiDesk allows you to come in at the three levels of personal care and the social care and your financial care and organizational care, and using the whole visual concept to be able to, in real simple terms, see each other and to be able to smile.
Mm.
Never underestimate. I always say to our new PAs, a smile goes a million miles.
Literally, absolutely right.
Goodwill, the goodwill you create in the moment, the loneliness and stress and trauma is unbelievable. And it's all about not what you do, it's how you do it. It's how you do it. It's compassion from the heart, which people pick up on. Without a doubt, they pick up on it. And that will be that's I think now in the foundations of the Hub and Hablets, which hopefully will continue well into the future. That compassion and respect. It has taken sort of 25 years for us to get this far, but the tech is available now. But we did it slowly, and we built the company brick by brick. But the second hub off the production line is very, very successful. So we know the model works. So it's something physical in real time that we can draw on. And we've all worked very, very closely and very well together, resulting in no COVID cases at all in the community. We've kept the community safe. The government have been fabulous with PPE. We've had so much PPE protectors. It's been absolutely wonderful. And I vaccinate as a volunteer on a rota system when I can. But it's all about collaboration and working together for the greater good, and with all the health and wellbeing principles. That's my thoughts.
I think certainly despite us working from afar in a lot of cases over the pandemic, it really has proven to be an opportunity to strengthen those human connections between us, hasn't it? We've become almost stronger within the isolation side of things, haven't we?
I think that's absolutely right. I think we're as Jeanette talks about, we need to move from learned helpfulness. So I go on about being the marketing guy in the 4 Ps. When it comes to FlexiDesk, we were talking about it this morning. I talk about being positive and proactive. Jeanette talks about preventative and personal. And if you can put those 4 Ps into it, so from going way back and doing customer care programs, people like Topshop and Butlins and British Airways, I'd now want to go back and say, can I please talk to you about doing a care and wellbeing program? So you have a colleague care and wellbeing program. You have a customer care and wellbeing program, because every connection, or both of those involved, but anybody involved with your clients, with your community, whether you're at work, at home, at play. And it's not just for those that you care for. In Jeanette's organisation, everybody in that community is responsible for building the care and well-being of each other. So our whole concept of putting the 5 stars of outstanding care is people-focused.
Yeah, and I think, Scott, you're right. One of the great positives that's come out of the pandemic is to see how people pull together. And you often read about people saying, I never spoke to my neighbours before. And coming out to clap the NHS, it creates a real community spirit. And we need to find positive ways to carry that forward, to encourage people to work together, to support each other. And for all the organisations, because there can be quite a number of different organisations working, interacting with people who require care. So it's encouraging them to pull together and build on that sense of community and positivity.
It is certainly. And another one of the positives, I think, that has come out of the pandemic as well is that acceleration of the hybrid working platform that, of course, this whole concept is based around. And the statistics also show that the support is there. I suppose that now 54% of people who are working in offices, they want to be able to continue to work in a hybrid format. I think 93% of people now also would prefer an employer who offers hybrid working as an option. And I think it's so beneficial as well for the work-life balance, isn't it? As well as also for sort of environmental concerns. So what is very clear is that hybrid working is going to be part and parcel of the way that business works in this country in the longer term.
I think the issue that Yonder Desk brought to me, which is why I just love it, and I just think it's such a wow, is you can talk about hybrid working, you can talk about working from home, and you can talk about Zoom calls, which can be with a global audience, but are we trained in how to do that and how to truly connect, or are we trained how to communicate and get our point across, or team-based calls? But the critical bit is, what environment are you actually doing that call in? And if you can see somebody in their own office or sat outside in a lovely environment in the Wellbeing room, or have a chat in the training room, and that's what Yonder Desk brings. And so the whole concept of FlexiDesk Online allows us to bring, as Sally says, the village green. And if you want to have a chat outside on the village green, and to be able to connect and fully connect visually in the right environment, where you don't have to fuss around what platform you're talking or listening or viewing at, is such it's a game changer that adds so much to our whole well-being. So the statistics that sit around 90% of people would choose an employer that's offering hybrid working. I think what we add is the plus sign is critical, offer hybrid working and well-being that goes with it.
Absolutely, Kevin. I mean, all our staff at the hub, they work in a hybrid context. It's very flexible. We've been flexible for 25 years. We've always run this because you have to prioritise health and well-being, and then everything pivots around it. So that's, maybe we were ahead of the curve. That's how we've always done things. Give them flexibility, and in return, you get a healthy workforce. It's a good long-term investment.
Yeah, that's great, Jeanette. And I think the thing with hybrid working is that there can be a fear that if you're not in the office and not being seen, then you're going to miss out in some way, and you'll be seen as a second-class worker and not be in line for promotion. And the great thing that Yonder Desk has done, and that we want to take forward with FlexiDesk, is sort of really integrating the two environments. So you don't feel that you're stuck at home trying to work from your kitchen or your spare bedroom or whatever, but you really do feel that you're integrated in the working environment, because you can see who's at their desk. And in a way, it becomes less significant if their desk is in their second bedroom, or if their desk is in the office. You're still visible to each other. You're still working together. It's still really easy to sort of virtually pop in and have a chat. So it's just a way of using technology to change the mindset, because we now, with the technology we have, we can do a lot of things that aren't dependent on geography. So it's making the most of that and doing it in the best way possible, so that people still feel they have a good sense of connection with their co-workers.
I just have to remind Jeanette here, because the core strategy sits around hubs and hublets of having your national, your regional, and your local. The tactical execution that sits under that allows us, with technology now, to put in research around the 5 ways, to put in training programs, to be able to see each other in our own environment. But sat around this is proof of concept. Is with the hubs and hublets absolutely working, focusing on your colleagues first and your community, which will get everything else right. So for us working with Jeanette, we're very proud to be working with Jeanette and Flexicare and everything that she's done. She's done a fabulous job in reality. The frustration, I sent you a picture, Scott, of her at the whiteboard and 10 years of frustration of trying to come up with new solutions, and her feeling at the end of the road, head in her hands. And I think to be able to now say there are solutions out there, ours and others, and we're happy to partner with all sorts of people that can make this work, and are talking now to financial people and to wellbeing people to try and pull all this together to create something that takes that core strategy of the hubs and hublets, of regional and local and personal, and puts it all together.
That sounds amazing, and thank you, Kevin. It's been absolutely brilliant to reconnect, although I don't think we ever did lose that connection, because maybe it was in the mind. I'm a great believer in serendipity, and I think it's a time where we need trusted leadership now. My board of trusted leadership was drawn in 5 minutes to basically try and help a colleague with a level 5, because the level 5 leaders of the future need to have a grasp of the continuum of what didn't work, so we can now focus on what works. But if we keep repeating behaviours, we keep repeating actions, then we get the same thing. So I'm just looking up at Einstein in the frame in my office. So So basically, we've got an opportunity here, and a real fantastic one.
Yeah, of course, and for certain, I think with, of course, the platform that you have here, I think there's a real foundation there for meaningful change moving forward.
Sally's reading the great book on
the power of
now, and so the core message.
Yeah, so well, whatever you do it with passion, and do it because you believe in what you're doing. And then you can't go wrong.
And have fun doing it.
The Power of Now, I read 10 years ago. It was a present from a colleague who helped me very much in the early days, and still involved in training in Yorkshire. And she gave me this little book called The Power of Now. One Christmas I read it, and I thought, aha, that's my aha moment, Kevin. You've got to focus on the real time, and everything's got to be real time. So thank you, Scott and Sally.
Yeah, thank you, Scott.
Yeah, thank you so much.
Yes, thank you all of you. And just lastly, before we do sort of finish up on the show today, this time in 12 months, where do you see this vision having gone, and what are you really hoping to achieve as we hopefully move into the next phase?
I'd like to come up to sort of retirement from the Leaders Council, thinking that there is a solid foundation down for a very different future, where health and well-being, community spirit, and positivity and smiles permeated every county, and we could all move forward together into a new world. That's my vision for the future.
Well, I think it'd be really great if the whole hybrid working, yonder desk working experience is really picked up and used across all communities, but I can see particularly in the care community and doctor surgeries, it would just really enhance everyone's working experience and for the users as well. So I'd love to see this hybrid working really adopted as a long-term solution, coupled with well-being, because it's good for people and good for the planet.
I think my single simple goal, Scott, sits around us recognizing that the climate change that we're going through now has created a new, what I would call a climate change. And once leaders understand the climate that needs to be within their organization, a climate of hybrid working and well-being, a climate of adopting the 5 ways to well-being as part and parcel of what we used to got the visions and missions and values. I think if we had the 5 ways to well-being as the core 5 values of every organisation, the thing that I've learned about it is you can put virtually everything you do against people connecting, about people being active around the things that you do as an organisation, about the things that you're doing to take notice of what's going on and around you and how people are feeling, and certainly keeping learning. Keeping learning is a way of well-being. So where people stop say, I know how to do my job, yes, but the learning is a well-being issue for you. So what is it you'd like to learn, because it'll help? And then giving. If you take Salesforce, they have a 1%, 1% of time, 1% of product, and a 1% of money, and that is a giving, and that sits as part and parcel of 5 ways of giving. So giving your time, but most of all, giving a smile.
Yeah, absolutely fantastic. And let us hope that more people are sort of drawn towards the approach over the course of the next year. And I do wish the project all the biggest success in the world. And lastly, just before we do depart, please, all three of you, do take care and stay safe with all that's still going on, because we're not out of the woods with COVID yet, but let's just hope the better days are ahead.
Thank you very much.
Thank you, Scott. Thank you. Have a lovely day.
Sam as well.
Scott.
It was a pleasure on today's programme to connect with Jeanette Phillips, CEO at Flexicare UK, and Kevin and Sally Thompson from WoW 5 Ways and 5 New Ways to Wellbeing. And I do hope that you all thoroughly enjoyed a compelling interview, learning all about their new concept. Until next time, now that indoor hospitality has returned and restrictions have been lifted in England, I'll be heading back to my usual spot in the Westminster Arms to raise a glass to outstanding leadership, and hopefully over the coming weeks we will continue to keep taking further strides toward normal life. Remember, we're not out of the woods yet, everyone. Please do continue to look after yourselves and be considerate of others, because it does make such a difference in saving lives during this period. We're almost there now, I'm sure. Take care and goodbye.